Nurse Ada, what is heart bypass surgery? A heart bypass surgery, as commonly known, is a coronary artery bypass graft, or CABG. It is a surgical procedure to treat severe coronary artery disease. It restores normal blood flow to the heart by bypassing the blocked artery. This is done by using a healthy blood vessel called a graft. The grafts usually come from the person's own arteries and veins, located in the chest, leg, or arm. The graft creates a new pathway to carry oxygen-rich blood to the heart. Where do you get the blood vessel to use for the bypass? There are two sources of blood vessels for coronary artery bypass grafts. It could be an artery or vein. The arterial graft sources are the internal thoracic artery and the radial artery. Internal thoracic arteries are also called internal mammary arteries. It supplies blood in the breast and the anterior chest wall. The vein graft sources are the saphenous veins. Saphenous veins are the veins in your legs. How does the surgeon attach the graft to bypass the blockage? If the surgeon will use the internal thoracic artery graft, he will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery, just beyond the blockage. The surgeon will then saw the graft into place. For the saphenous vein graft, the surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. How do the doctors choose the right graft? The choice of bypass graft depends on a number of factors. First is the location of the blockage. Next, the extent of the blockage and the size of the coronary arteries, the availability of arteries and veins, and patient medical factors. According to previous studies, arterial grafts are better and more durable than veins, so the doctor will prefer to use the artery than veins, but that still depends on the other factors. Internal thoracic artery or the mammary artery is the most commonly used bypass grafts. It is the best choice for long-term results. The left internal mammary artery or lima has been associated with long-term patency and improved survival. The radial artery is another common type of arterial graft. It is located in your arm. There are two arteries in the arm, the ulnar and radial arteries. The ulnar artery delivers blood to the arm, so most people do not have any side effects if the radial artery is used as a graft. If your surgeon decides to use your radial artery, you will have tests before and during surgery to make sure this is the best option. When the doctor will use the radial artery, he or she will perform Allen test to determine whether blood flow to the hand is sufficient. I will show you a video how the doctor do the Allen's test. Ask the patient to open and close the hand for several times as quickly as possible. Then palpate and apply pressure to the radial and ulnar arteries at the wrist. This occludes the blood flow to the hand. Have the patient make a tight fist and then open his or her hand. The palm of the hand should then appear white or pale. The examiner then removes the pressure from one artery. The color should go back less than 5 seconds. If the color will not return less than 5 seconds, the test is positive. Repeat the process to check the ulnar artery. Ask the patient to open and close the hand, then remove pressure from the ulnar artery to assess for ulnar artery circulation. The radial artery has a muscular wall. It has a tendency to go into spasm. You may need to take a calcium channel blocker medication for several months after surgery. This medication helps keep the artery open. It is because radial artery has a high rates of graft occlusion. But the advantage of radial artery graft is the easy preparation and availability for use. It is also more resistant to development of atherosclerosis than a vein graft. Some people who have radial artery bypass grafts have numbness in the wrist after surgery, but this sensation usually goes away. How about the saphenous vein? What are the advantages and disadvantages? The saphenous vein is commonly used for bypass due to the ease of harvest, which can generally done through small incisions, which is less scarring and faster recovery. But the disadvantage is the failure of vein grafts over the long term remains a significant problem. The reasons are that saphenous vein is variable in quality and size. There are presence of valves within the veins, and the potential for areas of dilatation. That's what we call varicosities within the veins. If the doctor will use your saphenous vein from your leg, he or she might do a surgical cut along the inside of your leg, between your ankle and groin. The doctor will just make small cuts just enough to pull the vein out. He or she then attach the other end to an opening made in your aorta. Then the other end will be attached after the blockage in your coronary artery. So bottom line, in choosing the best graft depends on many factors. According to what I've read, for older and sick patients, an internal thoracic artery graft and vein graft will likely be suitable. It is because the use of 2 or more arterial grafts may not be the best option. It is because it requires longer and tedious surgery. But if the patient is young and healthy and can tolerate a longer surgery, using multiple arterial grafts will give the best long-term result. What happens during coronary artery bypass surgery? Before the surgery, the doctor will put an IV line to administer medicine. They might also insert a central line for the swan guns to monitor the heart pressures during the recovery period. They will insert an arterial line to monitor your blood pressure and to monitor lab works. You will have general anesthesia for the surgery. This will put you to sleep for the duration of the operation. They will insert a breathing tube through your mouth and into your throat to help you breathe. The breathing tube will be connected to a ventilator machine. A Foley catheter will be inserted to drain your urine and to monitor your status. During the surgery, the surgeon will prepare the arteries or remove the veins that will be used as bypass grafts. The surgeon makes an incision down the center of your chest, through your sternum or breastbone, so your heart and coronary arteries can be seen. He or she will then cut the sternum and move your rib cage in order to get to your heart. Your heart will likely be stopped for a short time, so the surgeon can perform the bypass procedure on a still heart. During this time, the heart-lung bypass machine takes over for the heart and lungs, so blood keeps moving throughout the rest of the body. This is called On-pump surgery. The heart-lung bypass machine adds oxygen to your blood and pumps it throughout your body during surgery while your heart is not beating. The doctor might also attach a pacing wire into your heart in case you have abnormal heart rhythm after surgery. Abnormal heart rhythm after surgery is common. Depending on the surgeon's preference, the wires may be attached to a temporary pacemaker to control the heart rate or to prevent low heart rate. A temporary drainage tube will also be placed through the skin beneath the incision. Once all these procedures are done, the surgeon will use electrical signals to restore the heartbeat. Once your heart is again beating normally, the heart-lung machine will be disconnected. Your surgeon will wire the breastbone back together and suture the skin incision closed. After the surgery, you will be taken to the intensive care unit. The activity of your heart will be carefully monitored by a CVICU nurse. He or she will closely monitor you to prevent complications that might happen. Once you can breathe on your own, your breathing tube will be removed and replaced with an oxygen tubing. Expect that there are a lot of machines, monitors, and IV medicines in your room. The Foley catheter will remain in place until the surgeon will order to remove. It is usually removed on post-op day 2. As you recover over the next 3 to 5 days, all of the devices will be gradually removed, including the pacing wires and chest tubes. How many hours the surgery takes? A coronary artery bypass surgery generally takes 3 to 6 hours, depending on the number of arteries that are being bypassed. Are there different styles to the CABG? Yes, CABG may be performed in 3 ways: the traditional or on-pump, the off-pump, and minimally invasive. In traditional CABG, the chest is cut open, and the doctor will place you on a heart-lung bypass machine to take over the function of the heart and lungs during the surgery. In off-pump, the chest is open, but the heart-lung bypass machine for pumping blood is not used. With minimally invasive CABG methods, only small cuts are made in the chest, and a heart-lung bypass machine is not used. Example of minimally invasive procedure is robotic procedure. Robotic procedure is done with the aid of moving mechanical device. What do you expect after surgery? What do you feel? When you wake up from the heart bypass surgery, you will have a tube in your mouth. It is important to follow the nurse when he or she will assess you. He or she will ask you to squeeze his or her hand and ask you to wiggle your toes. These are some of the criteria to remove the tube in your mouth. You will feel pain or have side effects from the procedure, like pain at the incision site, pain with deep breaths, and pain with coughing. Pain with deep breaths and coughing are often caused by the chest tubes, so it is hard to go zero with your pain, but you can always tell the nurse you are in pain so she can give you pain medicine to maintain the pain in tolerable level. What are the risks of heart bypass surgery? The complications of heart bypass surgery are bleeding, arrhythmia, blood clots, chest pain, infection, kidney failure, heart attack, and stroke. Who will help perform the bypass surgery? Throughout the surgery, several types of specialists ensure the procedure is performed properly. A perfusion technologist works with the cardiopulmonary bypass machine. A cardiovascular surgeon performs the procedure, and an anesthesiologist ensures anesthesia is delivered to your body properly to keep you unconscious during the procedure. Imaging specialists may also be present to take X-rays to help ensure that the team can view the site of the surgery and the tissues around it. How long is the recovery of CABG? The recovery from heart bypass surgery can take 6 to 12 weeks. That's the least amount of time it takes for your breastbone to heal. During this time, you should avoid heavy exertion. Follow your doctor's orders regarding physical activity. Also, you should not drive until you get approval from your doctor. It is because the airbag might deploy and presses your chest during an accident. Your doctor will likely recommend cardiac rehabilitation. This will involve a regimen of carefully monitored physical activity and occasional stress tests to see how your heart is healing. Thank you, Nurse Ada, for the informations. I learned a lot today. You are welcome, Jenny. To all my viewers, thank you for watching. If you haven't subscribed to my channel yet, press subscribe and the notification button in my YouTube channel. Follow me in Facebook. Thank you for your support.